Good evening.
Good evening.
My role here tonight is to talk about the public policy piece that should go along with the expansion of Medicaid. Here in South Carolina, there is a political dialogue developing, a debate, if you would, as to whether or not politically South Carolina will expand the Medicaid program. We, as the rest of the country, are dialoguing around that issue, and as you've heard here tonight, there's a great deal of passion on both sides. But the reality is, the facts are facts. South Carolina is a state in many ways that really is two states. There is one South Carolina that is doing exceptionally well, but there's another South Carolina, a South Carolina in terms of health care that looks more like a developing country than the rest of America. Let's take, for example, Barnwell County. Barnwell County here in South Carolina recently lost its hospital. It also lost its state health department office. It also found itself with no doctors operating or serving in that county. So what do people in Barnwell County do to access health care? They have to travel to Orangeburg, 40 miles away. Well, what happens to people who don't have access to public transportation or own a car? How do they access health care? And I use this example to point out the fact that this is not unusual in South Carolina, particularly in our rural communities. Access to health care also means access to transportation. If health care does not exist in your community, people in Barnwell County are well familiar with the lack of access to health care, how difficult it is to see a doctor, to get to a doctor. So I ask you tonight, when we talk about health care expansion or Medicare expansion here in South Carolina, what should that look like? Well, let me pose a few things to you this evening. First, it ought to expand in a way that empowers people to take care of their own health. One of the things you saw on one of the maps earlier was this corridor of sickness that ran through the PD here in South Carolina. Anybody want to know where that is? Some people call it the corridor of shame. Others call it the I-95 corridor. All of those are communities that have limited access to health care. You say why? Well, poverty does play a role in that. But the reality is, whether it's poverty that causes it or not, the reality is access to health care in that community or in those communities is very limited. The other thing I would point out to you is this. When we talk about the public policy debate about whether or not to expand Medicaid in South Carolina, you've heard a lot of good reasons why we should. But here's the kicker. Unless you mobilize in your own communities to educate people about why we need to expand Medicaid, it will not happen. We need you to begin talking to your state legislators, your state senators, and your governor about why Medicaid needs to expand in South Carolina. We need to be deliberate, and we need to be clear about why that needs to happen. As a legislator, one of the things that I will tell you is this. It concerns me when we talk about tax dollars flowing out of South Carolina to fund health care in other states. And that is a very real possibility here as we engage this issue of the expansion of Medicaid in South Carolina. I don't know about you, but I would much rather see those dollars spent in South Carolina to help people gain their health here, particularly in communities that have historically been underserved for health care. The question for all of us in shaping public policy around the expansion of Medicaid is simply this. Are you willing to participate, to speak to your elected officials about the need to expand, or will you simply sit on the sidelines and watch things go by? Today, I want you to understand that the Medicaid expansion is a tremendously generous program for South Carolina. tremendously generous because, as you've heard, billions of dollars flow into this state's economy. By some estimates, we're talking about as much as 2 to 3% increase in our GDP. That's a tremendous increase for a state like South Carolina. We're talking about as much as $11 billion flowing into our economy. I ask you this question. The public policy debate requires the participation of our citizens. Are you ready to do that? Tonight, the Medicaid expansion that we've been talking about has so many tentacles that reach into so many areas of our lives. If you are pro-reduction of taxes, particularly if you're talking about health care costs, then you ought to be embracing the expansion of Medicaid. Because all the studies that I have seen have said that uncompensated care that costs this state so much will be reduced. Because if people have access to care, particularly preventive care, they don't get sick and they don't show up at the emergency room, which is the most expensive care that can be offered in South Carolina. And your cost and my cost, our tax dollars, don't flow out to pay for uncompensated care. Well, the question for you might be, well, I don't remember paying for uncompensated care. Well, do you have insurance? You ever wonder why your rates are so high? It's because of uncompensated care. These insurance companies, these hospitals will recover their lost costs. And guess what? You're going to pay for it. The cost of health care in South Carolina and in this country has been rising dramatically for more than 2 decades. And much of it is driven by this uneven access to health care and the lack of emphasis on prevention. Today, as we move to bring the Affordable Care Act into play across this country, it affords this country and South Carolina an opportunity to impact on the quality of life of its own citizens, as well as to extend the lives of people who live in this state. South Carolina, United States, all have a challenge before us, and it is a public policy debate. I leave you with this. The United States currently ranks 37th in the world for life expectancy. And as you've seen, we spend more money per capita than any country in the world on health care. Have you ever wondered why this incongruency exists? Why can we spend so much on a per capita basis for health care and get such poor returns? The reason is that this country was the only developed country on the planet that did not offer national health care. Now that we're moving to implement it, will South Carolina allow itself to be among the few states, possibly the only state, that will not implement the expansion of Medicaid and the full implementation of the Affordable Care Act? If we fail to expand it, we leave hundreds of thousands of our fellow citizens to languish without access, to face escalating sickness and early death. It is a moral issue as well as an economic issue. And it's one that all of us as citizens must engage, speak to our elected officials, and drive this discussion to its conclusion successfully. Thank you so much.